Welcome back. On our program recently, you met a student from the University of Toronto who contemplated ending her life. A cry for help to mental health services on campus eventually turned into a conversation with campus police about her suicidal thoughts. Then, this.
The minute I told them that it was a real location, it was a bridge, but that I would be going to my friend's house, they stopped everything and they told me that I would be put under arrest.
I was bewildered. I couldn't believe that this was happening to my friend who at this point had been so cooperative and she'd been so open.
Then, just a few days ago, we heard from the Vice Provost at U of T about how long students wait for professional help.
So understandably, there's going to be a range of cases and a range of wait lists. How long is the wait to get counseling services, for example?
When a student needs care, what we're doing is we're looking at what is the urgency and what do they need, and in terms of how can we support them.
So again, what's the range of waiting?
The range of waiting really varies by individual students and individual cases. We would prefer that there's absolutely no wait lists, and we're doing our best to see students as quickly as possible.
Hard to get a clear answer. It all points to a problem that is in desperate need of better solutions. So on tonight's Second Look panel, how it all works, what services are available on campus, how to get them, where the shortcomings are, and how to shore those up. And as we do every Friday, we have help. On my left, we have Lucinda Q, who goes to U of T. You're an undergrad and one of the founding members of the Mental Health Policy Council there. We have Eric Windler on my right, the founder of Jack.org. That's a national nonprofit focused on young people and mental health. And we have Dr. Juveria Zahir, a psychiatrist with the Centre for Addiction and Mental Health based in Toronto and operating in communities right across Ontario. So folks, to the three of you, thanks so much for being here. Dr. Zahir, I'm hoping we can start with you. Just on that question of wait times, can you explain for us, why is that such a hard number to pin down?
I think it's a complicated question. It seems like it should have a very simple answer.
Sure.
If I'm a student and I go to student health, how long is it going to take for me to see someone to help me?
Right.
The answer is a little bit more complicated because services are challenging. When there's a lot of different people who have different types of mental health issues, people do something called triage. So you're trying to understand who is potentially at risk for suicide, who is having symptoms of psychosis, who is having struggles with academic performance, who is having struggles with anxiety or depression. All of this to say, though, we can say things like 4 weeks or 6 weeks. It may not seem like that long in the general mental health care system, but for young people who are struggling, 4 weeks or 6 weeks can mean the difference between passing and failing, from keeping their student visa or not keeping their student visa. And so I think that's why they need to know what's happening.
And Lucinda, I mean, is that what you hear from the student body in terms of the wait time? I mean, 4 to 6 weeks is kind of the norm?
It may be the case at other institutions. It has definitely been the case for some students, but I think one of the most frustrating issues at the University of Toronto is that students have been advocating for the creation of a proper triage system, of a proper intake or single entry point for a very long time. And obviously we're working against some particularly acute or unique barriers when we talk about 3 campuses and 90,000 students, a city within a city. Yeah. So instead then what you see is wait times of a couple months, 6 to 8 months.
But I guess, I mean, there is a cost to waiting, right? And I think of someone, a student in distress, right, who has some grave problem that they're trying to work through. When they're told that, listen, it'll be 4, 5, 6 weeks until we can connect you with a counselor on a regular basis, what's the impact of that? I mean, just on a human level, what does that do to them?
We ended up associating this symbol, this pound or number sign with some of our work after the last suicide, because this story is about human beings being treated like numbers and a mental health crisis that is an accountability crisis. If someone says they need help, they need a single advocate in their corner, it is devastating. It really is the difference between life and death right now for so many students to be told, actually, you can't get the help you need.
Eric, I mean, in terms of the way you approach this issue, I know, I mean, you have a very heavy professional investment in all of this, but also an intensely personal one.
Yeah, so for those who don't know, we lost Jack by suicide in March of 2010. And we didn't even know Jack was struggling. Okay, a lot has changed since then, but I can assure you there's no family out there that wants to go through what we've gone through. So after we sort of picked ourselves up, we decided we would try to do something about it. And my wife, Sandra, and our closest friends piloted our what's called our youth leadership, youth engagement model in mental health with Queen's University. And fast forward now, we're on 250 campuses across the country. 67 of them are post-secondaries. But if I look back to those days where Queen's was being kind of raked over the coals, they had had a rash of suicides in 2010 and 11, and they really stepped up. Okay, they're one of the schools that stepped up. They formed a principals commission on mental health. They involved students and faculty and family members and the mental health professionals. And the way I would just like to summarize it, we're having a bit of a crisis across the entire country.
Right.
Yes.
But then let's talk about the pan-Canadian picture, right? Because I know that your organization, you recently undertook a research project where you talked to students right across the country. And there was one particular finding that really stuck out, and I want to show it to you folks. So to the statement, "I feel as though mental health services at my school are adequate and would meet my needs." More than 1,000 students weighed in, with almost half either disagreeing or strongly disagreeing with that statement. Eric, I mean, in trying to figure out how best to help people, I mean, what services are typically available?
First of all, it's all over the map. But I would like to, if I might, paint a picture that I think is very important for people to understand. And that is, in the last 10 years, there's been a huge amount of progress in awareness, education, increase in help seeking. And if you like, that's kind of been on a trajectory like this. It's really been growing incredibly fast. And most schools are getting on the bandwagon. They're doing something, and they're somewhere along the path of figuring this out, this very complex issue. But the trajectory of access is a much flatter one, okay? They're all better, trust me. What's going on at Queen's, at U of T, many places around the country is far better than it was 10 years ago.
Yes.
Infinitely better. But that gap is widening.
But what is the root of that problem? Is it a numbers thing, that there aren't enough counselors, aren't enough staff? Is it that there are many more students presenting with mental health?
There's many more young people reaching out for help. The world that we live in today with social media and all the things that are going on in the world are adding to the stresses and burdens of young people. So there's more young people comfortable reaching out, and they are more highly stressed and anxious, and they're struggling more with their mental health.
So Dr. Zahir, is this an issue then that I mean, we can counsel our way through? I mean, because you paint the portrait, Eric, of a tide, this crushing weight. And I don't know how you solve that with more counselors, more psychiatrists on the ground, because the problem is still there.
To Eric's point, we know that in the last 6 years in Ontario, there's been a 33% increase in emergency room visits for young people. And so when you talk about that rising tide, sometimes emergency services become the place where we see that signal, because people are having a lot of difficulty accessing mental health care through their family physician or through student mental health. I think the solution, it involves all of us. I think universities traditionally have been an institute for higher learning, and they are learning along with us to have the resources available for people. You know, young people are at an age where major mental illness emerges and worsens and deepens. So I think in order to solve this problem, we need coordinated care, coordinated access. We also need organizations like jack.org, where we do peer support. We need student advocacy. We need our hospital system and our mental health system also to be able to account for this increase in need.
Lucinda, I mean, I know this is a question that you've given a lot of thought to in terms of how you actually go about tackling the problem. Is there something to be said about tackling the sources of stress and anxiety for students?
This is a crisis that looks like you said, every single actor recognizing that they have a role to play in stopping someone from falling through every possible crack. And so, at the end of the day, I really think people have to be thinking, are students earning a living wage? Are students being given academic forgiveness policies? Are students being connected to one another and being allowed to build their own communities and supportive relations? Or are we just becoming, again, numbers in this huge system that makes us feel like there's no way out?
I do want to do one last go around, and I just want to ask you guys, I mean, you've all thought about this problem for so long and from so many different angles. Is there, if you could pick out one thing that, hey, I wish more people understood this or more people, realized about the problem or the kinds of help that they can get. Eric, let me start with you. What would you say?
Yeah, so I would say every family needs to start thinking about this long before their young people get to post-secondary. Mm-hmm. They need to be having these conversations, in the very early teens at the latest about what mental health is all about, and really having a thoughtful conversation that doesn't put so much expectations on their kids and shares their own struggles so they get more likely feedback from their kids that their children that they could be struggling.
Dr. Zahir?
What I think I would say is to families and to young people and to mental health care service providers is that there's a way out and there's hope, and that it's our job to listen and to support you and to let you know that there are other ways of being. And it's our job to treat those symptoms that make it so hard for you to live the life that you want to live.
Lucinda, I'll give you the last word, something that you wish more people understood or realized about this problem.
If anyone is in a position where they have influence, where they have stability, they have a role to play. And I hope that every person starts thinking more about what that role could be, what evidence-based models and expertise there are out there that can help them grow in that capacity. And if someone's struggling, I just hope a lot of young people take away this message of you deserve help and care, and you deserve a future that you can look forward to.
We'll leave it there. Guys, thank you very much for your time. I appreciate it. One more note on this. If you think someone you know may be at risk of suicide, or if you need to talk to someone yourself, Canada Suicide Prevention Service and Kids Help Phone are there to help you. You can call them, text with them, or chat with them online.